So today I'm going to talk to you about gum disease and where it starts from. I've got a model over here. Now this is teeth and this is your gums, okay? And the area where plaque tends to sit, plaque is food debris combined with bacteria. The place where it tends to sit is in this little groove between the gum and your tooth. So when people are brushing their teeth, if this probe was of the bristle of your toothbrush, if they just brush like this, they can often end up missing the most critical area where you would get plaque getting trapped, and that is around here. So you really literally have to, if that's 90 degrees toothbrush bristles to your tooth, you need to angle it so that it actually goes inside that groove. Now some people feel that when we give this kind of advice, this 45-degree angled advice of brushing in these grooves, some people think that it's actually going to rip away this gum and pull it back, and that's the cause of recession. That is not the cause of recession. Recession is something completely different. Recession occurs when you have actually infection occurring on your gums. It's actually made the attachment of this gum come away from your tooth, and then it starts to heal, and with treatment, and it tends to pull back and shrink. And when it shrinks, for instance, if you had an infected gum like this, where it's all red, puffy, swollen in comparison, if that was now to be treated and healed, then this redness would go away and this gum would actually shrink. And if it shrinks, then it will become tighter, but you will be left with gum recession. So gum recession is something completely different. So you will not recede your gums by brushing at this 45-degree angle. The other area to focus on is in between your teeth, and that's when flossing becomes really, really important. Now, if you don't do these things, then what tends to happen over a gradual process is you start initially getting swollen gum. The gum tends to be more rounded and more puffier and more redder than light pink, and then it starts to eat away the bone and starts deteriorating this root surface, and it can get really, really bad. Now once it's lost, we can't replace it. That's not going to replace. So that tooth will now start to get loose, and when that gets loose, that's when you start having even more problems. And this is a kind of tooth where you could end up getting infections and even an abscess.